So welcome to the next session, AWE session on motility. So we're happy to share with you new and latest technology in looking at motility. We have Dr. Blevins here. She'll walk you through the different modalities.
Thank you so much, Dr. Nguyen. So we're actually going to take a quick pause before we get to motility. These are products that are offered by Labary. The first one we're going to talk about is a wireless pH testing device. This device is called the Alpha One. It's very similar to other pH testing devices that you probably have used, but the thing that makes this one special is this has no nickel in it. So if you have your patients that have a nickel allergy, this is a really good alternative. Similarly to how most wireless pH testing is completed, the first thing that we're going to do is kind of do an endoscopy, make sure everything looks normal, find where our GE junction is. And then similar to other testing, we insert this device. We want to put our device that's this kind of little wireless probe. That's right here, again, nickel-free. We put the wireless probe about 6 centimeters above our gastric folds, our GE junction. This is kind of our standard care. The device then gets hooked up to suction, and we want to do at least 600 millimeters of mercury for 30 seconds. And then the deploying device is very easy. So it's a 1, 2, 3. And so the first kind of step after you've been on for 30 seconds, it deploys the little clip that will grab onto the mucosa, and then it's a 2-stage release. When with the actual wireless probe is in there, we've got this kind of little thing, just in case if you ever need to go and grasp it, there's a little lasso, a little plastic lasso here that we can grab. But then it's deployed. It's paired with this nice little pack here. This one has a little bit better range than other products on the market. We can go about 10 feet away, and so hopefully less likely to have drops in any product. It does give we can kind of tag to when our symptoms are. It does give feedback to the patient, says, oh yes, you did click that you're having heartburn right now, and so they at least know that kind of what they're doing, what they're pushing is makes a difference. So that is it for our wireless pH products.
Perfect. So when do you use that versus 24-hour pH study, and what else do you think of as an alternative?
Yeah, so I'm a foregut surgeon, so I always like our 96-hour pH testing because this is usually my first step to have objective evidence of an abnormal GERD, so abnormal acid exposure time, abnormal Demeester score, to see if I think surgery would help them or not. 24-hour impedance is, for kind of what are any of our for the wireless pH testing, the only thing that it does test for is just pH compared to kind of the 24-hour impedance, which looks for acid fluid, non-acidic fluid, and then also gas. And so again, specific question you're looking for will help you kind of dictate, because sometimes you do need both if you kind of want the longer study. The other thing, we still kind of have to worry about, there is still metal in the device, so you do have to wait after getting an MRI. At least 30 days to make sure that it's dislodged before doing any other kind of MRI imaging.
Perfect. We can always go back in with endoscopy and knock out the capsule if we need to. It's a pretty easy process. We can use a little snare. Oftentimes you have the patient eat something hard, and that'll knock the capsule off as well. So perfect. We'll talk about motility.
All right, next we're getting into the realm of our motility catheters, and so I'm going to start with the upper end, and so we're going to go over Labary's high-resolution esophageal manometry catheter. The thing that is, because this tends to be not the most pleasant test, but the thing that I would say that patients like the best is this is an thin 8 French catheter, so it's nice and flexible at the end, and the other catheters that are available on the market are 12 French, so we get about 33% thinner catheter, and patients do comment that it's more comfortable for a patient or for a test that can sometimes be uncomfortable. The placement's really great. We've got great training for our nursing team that can help place the catheters, and then our processing kind of data. That this is the only piece of equipment that with it is pretty small. If we need to kind of move it between hospitals, we can. And then the software that uses to analyze the data is also very user-friendly. It helps with a lot of the calculations, and so physicians that use it have reported that they feel like it helps a lot and makes kind of the processing and analysis a little bit easier, which is always nice.
We love that because esophageal manometry is one of those tests that patients have it done and they are traumatized and they oftentimes don't want to see you again, and so the smaller caliber of the probe really goes well with the patients. And then we get the information that we need for diagnosis. All these equipment are available, so we often talk about one-stop shop, so we can do a lot of it in one setting. So from the upper, we'll go to the lower part and we'll show you what that looks like.
Yeah, so the last pieces we have is a completely disposable high-resolution anorectal manometry catheter. It includes the balloon on it. It auto-inflates with everything, and so nursing has reported that it makes it a lot easier to kind of do the inflation. The balloon at the tip can be used for expulsion, and again, it's a completely disposable unit, which helps assure that everything's nice and clean.
Yeah, wonderful. Thank you. That was a wonderful summary.